North Dakota AHEC connects students to careers, professionals to communities, and communities to better health.
When Congress enacted AHEC, probably about 1972 or 1973, North Dakota was what was referred to as a first-generation AHEC. And it wasn't really, again, until coming into the 21st century when there were changes made to the AHEC program. The focus of AHEC really had shifted to heavy focus on rural. And we were able to create 2 regional locations, one for Western North Dakota and one for Eastern North Dakota, to work with what we now call the program office here at the School of Medicine and Health Sciences. So AHEC is a good example of, I think, a program that has significantly evolved and changed over the years.
North Dakota AHEC is located within the Center for Rural Health, and we serve as the program office for North Dakota AHEC across the state. And that means that we provide oversight and administration for the Eastern and Western centers in North Dakota.
We help with some of the grant reporting items that have to occur, but probably more importantly, we connect with partners across the state. So because AHECs have to be housed in med school, part of that is because we have a lot of connections with providers, with potential preceptors, with rotation sites, and so we, as a program office, help bring that to the table when we're working with our regional partners.
The main challenges in North Dakota, I don't think are unique to North Dakota. I think it's happening in rural areas across the country, but certainly we're struggling with number of healthcare workforce availability as well as distribution, meaning students and health professionals choosing rural areas to practice in when they're ready or finished with their degree.
When we get into some of the smaller communities, we really need not just physicians, but nurse practitioners, PAs, OTs, PTs, nurses. We need everything, and that whole system has to be supported so that we can make sure that people have access to care as close to home as possible.
Through programs like AHEC Scholars, we offer students enhanced learning experiences focused on the unique needs of rural and underserved communities. These future health professionals engage in interprofessional training, community-based learning, and hands-on exposure to real-world healthcare challenges.
North Dakota AHEC also supports rural and underserved clinical rotations by providing assistance to students who incur travel or additional housing expenses across the state. We also manage North Dakota Future Health Professionals, which is a statewide student-led organization that is 100% healthcare focused. A chapter can be started as early as middle school, all the way through collegiate level.
In North Dakota, HOSA is operated under North Dakota AHEC, and that is such a great program to help introduce students to health careers, helps improve their knowledge of what opportunities there are in healthcare going forward. We have a number of students throughout the state, a wide number of students throughout the state. So a great program to help our students get introduced to healthcare careers early.
North Dakota AHEC's mission is to connect students to careers, professionals to communities, and communities to better health. Healthcare starts with workforce. North Dakota AHEC is supporting the people who will care for our communities.